Oh, I think it's. I
What's up,
think we're good.
Anand?
I think we're good. All right, perfect, perfect, perfect. How's it going?
Everything is the same, like Corona everywhere. Everybody is in a very different state.
Yeah, Sandeep and I were just talking about how toilet tissue is the big issue.
So you
It's a
should come
big
to
issue
Nepal.
here in the
Huh?
U.S. Yeah, they don't have that problem in Nepal. You need to just use water like everybody else.
Yes.
Exactly. And the left hand.
Yeah, yeah. Oh man. All right. So today's session we're gonna record it, and then the students are gonna see this at a later time in this week. And we're talking about for this session being mindful of cultural differences, and how it's important for them as veterinarians to really serve their community, but be mindful of the situations of the community, engage with the community, as well as knowing like how to actually get involved and really tie in and speak with them. And so with that, we wanted to talk to you because you guys have an amazing clinic there that's doing a lot of work within the community, but also with engaging with the international community as well. But before we get into all of that, I just want to know, like, can you tell us about your journey to become a veterinarian, and why'd you choose this field?
Mhm. So, like, I was in love with animals since I was a kid, and then I used to have dogs. Like we were brought up in a countryside of Nepal, and then my father he used to love animals, and we had ducks, chicken, and then dogs, birds. Everything was with us, and I grew with them, and I was in love with all the animals. And I had a small dog, and then we had to take my dog to the veterinarian every year to get them vaccinated. It was back when I was a small kid, and I used to take him in a small bicycle to the vet hospital. And I loved my dog, and he used to sleep with me. He was my everything. And then the doctor there, he never treated him with love. He was squeezed in a cage for the injection, and then he was really horrified when he was at the vet. And then I felt really bad because I couldn't do anything, and I thought like it was how it has been done.
Mm.
And then I had the thing in my soul, like I have to do something for the animals. Back then, I was not sure like I would become a vet, but the thing was still inside my, inside my mind that I had to become something so that we could give love to animals. And then I grew up, and then I became like bigger. And our government used to poison dogs in the street
Mm.
back then, right? So I
Yeah.
used to feed all the dogs around my areas, and I used to go out with my brother, and then we used to feed like whatever we had to the stray dogs. And one day, early morning, when both of us went out to get the milk, we used to get the milk in the bottle before, and we had to go out of the house to get the milk. And when we were coming back, I saw like 15 of my dogs dead on the street. I
Wow.
was crazy, you know, and I didn't know why they were dead because last evening we fed them. They were all happy, running around playing with us. The next morning, all the dogs were dead. And I dropped the bottle and then I ran like crazy. I was crying and I was asking everybody, who killed the dog? Why are they killed? They were my dog. So I didn't, nobody could answer me. And I was really, I don't know what happened to me. I was really disturbed for like days and weeks. And my father and mother, they tried to tell me like, this is what happens. And then I felt really bad. And that made me more stronger to do something for the animals. And then after some months, everything was clear. I was back to normal. But still, the thing was with me, I have to do something for the animals. And then gradually, I became bigger. I grew up, and then like there was an opportunity to join the vet school, and I said, okay, I'll join the vet school. I was not sure I would become a small animal practitioner because we are not taught about small animals here. But I
Mhm.
wanted to do something for the animals. So I joined my vet school and I studied. I completed my study, and then I would ask everybody just to train me for the small animal practice. And I made a couple of expat here, and whomever I made, I said, "Can you link me up to the vets who can train me for small animals?" I would ask everybody, and
Yeah.
then there, yeah. here in American Embassy. So from there, one of my friend linked me with Professor Gretchen Kaufman. She was from America. And then I asked her, like she asked me, Pranav, what do you want? And she came to my clinic. It was a very small clinic. And then she said she wanted to give me some money. And I said, don't give me money. Give me training so that I can train more people like me who wants to serve small animals. And she was surprised. She wanted to give me $200. And I said, don't give me money. Because if you give me money, I'll spend it. Give me something which will, like, make everybody happy. And she went back. She didn't reply me. And then I texted her and I said, can you train me so that I can operate on a small animal? And she looked over everywhere and she linked me to a vet in India. His name is Jack Reese. And I went all the way to India and I got trained there to operate, like do spay neuter. And then when I went there, he was surprised because he asked me, have you ever seen a dog in your college? And I said, no. And why do you want to do small animal practice? And I said, I'm into it. I'm going to do it. And he taught me every little thing. He taught me anatomy. He taught me everything about dogs. He taught me how to handle dogs, how to restrain dogs. Everything was like he gave me all the instructions. And I felt really happy. And then he showed me the surgery. I saw the surgery and I've been practicing surgery every day I used to practice. And he gave me a chance to suture the dog and I sutured it. He asked me, have you ever done the surgery before? I said, no. It was my first surgery. He asked me 3 times. And after the stitches were done, he asked me, how is your hand so smooth? And I said, I practice it every day for 4 hours. I stitched on the clothes and I stitched bananas, I stitched grapes, whatever I got, I made the stitch, because I wanted to do the eye surgery. So I did it in grape because I had to peel it off, and I wanted to do the soft tissue surgery. So I practiced in banana.
Wow.
So I wanted to do the intestine. So I had to be very soft, so I practiced in banana so that when I put the stitches on, it doesn't break it off. And I stitched the clothes every day so that my hands were really smooth. And he was surprised and he was happy just to see how crazy I was for, the surgery thing. And he gave me some books and I came over. And then gradually I started doing things here. And one of my friends, I met her and then she introduced me to a vet in China. And I said to her, I want to see a hospital, how does it look like? Because I've never seen any hospital. And then I didn't have money for that. And I took loan from my, friends and I went to China and I stayed there. I was so happy to see the hospital for the first time, the fancy hospital where you can walk in with the surgery department, radiology department, the lab, everything was there. I was so happy. That was my day for, that was how I cannot explain how happy I was. I said that the most difficult problem was the language thing, because my translator just know to say yes, no, what, and fuck. He was my translator, and then I had to use Google I asked him to write it down. I translated it, and I had to, communicate them with Google. And my translator was very good because he just knew 4 words. And I stayed there for three weeks, and I learned many things. And then when I came back here, I designed my clinic, what I saw there. We have to have a reception area, proper reception area, and we have to have a waiting room, proper examination room, consultation room, a wet lab, and then the treatment room, surgery, everything I saw there. I took pictures. I came back and I, copied it here.
Yeah.
And I got books, and then I started reading about the books. And then fortunately, I met another friend of mine. She was her husband worked in the American Embassy. She was a vet. And when she came to see me, she pushed me, just you have to do the American standard. This is the world standard. You have to do this way. And when she saw my surgery, she was really happy, because the way I did it. And she asked me, where did you train yourself? And I said, I went to India, and then this is how I did. And then she asked me, how did you encourage yourself to become a vet? And I said, I encouraged myself, thinking myself to be the first vet in the world. I imagine, how did the first vet in the world treated the animal? Because he had no mentor. He had nothing. Right now, we have books, we have internet, and I have friends like you. So if you can guide me, I can do it. So another motivation is, a sick dog is in my clinic. If I treat a dog, he's going to die because I'm not well trained. If I don't treat a dog, he's going to die because he's not getting treated. You know, I had no options. So I consulted the book. I consulted the case review. I did the internet researching. My guru is YouTube. You know, YouTube. I did it, and like because of the God grace, most of my surgery was successful. So none of the dog died at my table, and that's how like I got the encouragement, and I had to do something for my community as well because people didn't know what dog is, and then what is the impact of the dog in the society, and we had rabies every year. I have seen human casualties, guy dying of rabies. Is so pathetic, So I had to do something for them. So I consulted my friends, and then they gave me some ideas about mass vaccination. We collected money, and then we treated the dog in the street. Everybody used to laugh at us. And after some time, they realized, okay, they are doing good. And then I discovered the blowpipe. I was watching a movie, and then, the ninja hit blowpipe. And I said, shit, if you can kill a person with a blowpipe, why can't we hit a blowpipe with a vaccine? And then, fortunately, Gretchen Kaufman had organized the wildlife tranquilization program in Chitwan. I couldn't go there because I had no money. And then I said to her, I cannot afford to come there because I have no money. She said, don't worry, Pranav. It's because she knew how passionate I was. She came all over here at my place with her friend, Professor Coleman, and I don't know, I just forgot his name. He was a wildlife veterinarian. They came here, they trained me, how to use a blowpipe. And they trained me how to make a dart thing, syringe. We made it. I practiced it every day. I made my local blowpipe, and then when I was confident, we did the blowpipe vaccination thing here, which, it was really nice because we could do it very quickly, very efficiently. We had no dog bites because before we had to catch them, we get bitten, and it was a big hassle. And then everybody appreciated that. And then they started calling me dog father, this and that. So that's how my journey started. And then I have gradually set positive impact about a veterinarian in my community. Now people have started saying okay, now my son will also become a vet like you. People come to talk to me, and then they ask me about my work, and I say the best thing what I get is satisfaction, because no matter what you work for money, you work for your thing, but unless and until you are happy, your life is not successful. So when you treat any animal, and then next day when you see him wagging the tail, that is satisfaction. That gives you the euphoria, and that is the energy for my life. That's what I tell them, and it is. And people get impressed, and then they are motivated becoming a vet.
That's awesome. That's awesome. That's awesome. All right. Can you describe your approach to veterinary medicine?
So I have a very holistic approach because, I call myself Columbus, because when I became a doctor, I was not sure what I was doing. And I use all the approaches, like my Ayurveda knowledge about using local herbs. I used all the local practices. When I do off-roading, I go around, I meet local people, and I ask them, how do you treat your animals? The traditional method of treating animals. And then I always write down, what do they use? So my aim was, if I'm a doctor, I should be in a position to treat animals in any condition, without any machine, without anything. If I go to the jungle and I get a sick animal, how would I be able to treat it? How would the bushmen or the forest people treat their animals? That was my thing. And I did research, and I contacted them, and then I used their technique too. I use Ayurveda, I use local techniques, I use traditional techniques. I use medicine, traditional Chinese medicine. I have little knowledge about homeopathy, and then the allopathy, which is used widely. I combine everything. My motive is to make animal happy. So I deal with energy. So what is the thing that makes you healthy? Is the energy. What keeps it in balance? Proper food. So my concept is, if your dog was not with you, where would it have been? In jungle. So what would the dog eat? Meat. If the dog is in the proper diet, 90% of the food, like 90% of the health condition depends upon the food that you eat. So food is the thing that makes you sick. Food is the thing that makes you healthy. So you want to know what food to eat when. So that's the basic knowledge that I have. I use it. And then ultimate goal of my life is to make everybody happy.
Oh man, that's awesome. That's awesome. All right. Can you tell us about how your clinic engages and serves the community, and then your approach to the community as well?
The first thing, what I've been doing till now, since 15, 16 years, is advocating about dogs, what dogs are. Religiously, we are connected with dogs because dog is one of our deity's animal. So what does dog needs? What is its basic requirement? Food, shelter, well-being. How do we maintain that? And what are the things we get, because people will not invest on animals unless they see any benefit. So I try to advocate about the benefit effect of dogs in the society. Could be community dog, could be household dog, could be stray dogs. And then I try to tell them, like, if they're not healthier, what are the impact that we get? So besides telling them to serve them, I tell them if they are healthier, we get this benefits. If this are sick, we're gonna get this disadvantages. So I encourage them the other way around. And then when I talk about rabies, I tell them, like, this is how we can prevent it. Just let us know, call us if you have dogs. And then they've seen our work, because what I believe is we call the earth our mother, right? Unless and until we give one seed, she is not going to give us back. So if we sow one seed, she's going to give 1 ton. So we worked for 10 years for street dogs, and they've seen the result. Now they trust us. So if they have any issues, they call us, we treat them. And they are encouraged, and they are happy to see dogs because they save their belongings from like getting theft. They protect their community from wild animals, and then rodents populations are also controlled. They are happy. Wow. So this is how I try to motivate people, showing them their benefit about the animals they're having in their surroundings.
Wow, wow. In terms of in the clinic and in the community, are you all the only vet clinic in your area? How many vets are in the? Yeah.
I am the only vet who serves small animals in my area. So people, they travel and then they come over. I have like 4 vets working together with me now, because very less people come in small animal because we have very less scope. Only the passionate one who has love and passion for them, they come and they enjoy here, because I'm not a vet. I show them life, So this is a very philosophical environment.
Oh, that's beautiful. That's why our students love to see you guys, man. They love coming there. All right.
Just a minute, Mr. Smith. So now talking about the community, here it's more like we try to do something for the human communities as well as the vet community, because like we've been telling that Nepal, if you see the history, we've been having dogs for since we had Nepal or the world, right? But still the veterinary sector here, it's more like 99.9%. If you say a vet, they would obviously, it means 99.9% would go for poultry or large animals. And canine practitioners are just a handful. Now, if you just count the numbers, they're like 3 full-time vet clinics or vet hospitals who are entirely looking after the small animals, canine and feline. Others, they're kind of mixed. They have their clinics, but they also serve poultry, large animals, and also some small animals.
Yeah.
So part of us for here is like we also try to uplift the veterinary sector or the veterinary society or the community, what we say, because even for the students, the college where Pranav was trained, they didn't ever get to see a dog. They never got to see a dog. They had intensives or they had trainings on poultries, large animals, and so many whatever things, but they didn't have even a space or maybe a session or 2 for small animals. And even now, it's like 2020. And if you look at the vet students and say that, okay, have you ever done a physical examination of a dog, or do you know how to restrain a dog? They said, like, we had read it, we had a session, but actually, we didn't get a chance to do that physically, because the entire sector is focused on poultry. They do lots of research or practices or farm visits on poultry and then large animals. But for dogs, it's still not done. So that's also one thing what we are trying to do. We're also trying to get engaged with the colleges and the universities, and not all, but at least maybe 5% of the students who might be interested, who are not actually interested, but who might be interested. So we're trying to get them on board and see, okay, this is what a vet clinic or a small animal clinic looks like. What do you have to do? What are the things? And then if the community starts seeing these things, this would also be one of the priorities. And also, we're trying to set standards for having a clinic. So what exactly a clinic has to be? It's not like a very fancy poultry clinic or large animal clinic. So this has the special requirement. This has the special things to be done. So at least since we don't have any standards here in Nepal, but there are international standards. So we're trying to bring up with the protocols and standards, and at least have a benchmark of what can be done, so that once we start doing that, maybe in a days to come, because at least one of them has to start. They didn't start it previously, and now we're starting. Maybe they'll adopt what we're doing maybe in 10 years, but at least we have started something. And now even the students or the future vets who are going to think themselves, okay, in 10 years down the line, I'm going to do a small animal hospital. So at least they'll get to see things. And then we're also trying to bridge in between the difficulties or the issues that Pranav had, because the time when Pranav graduated, there were none. And the people who were engaged, they were not willing to share the experiences, because they thought, I mean, this is not a typical Nepali culture. I think it's a global culture where your seniors wouldn't want to teach you, because they would ultimately think once he grows, he'll get the market and he'll be overtaking me. So it's kind of a social thing. So Pranav had a very worse experience. So he had to spend a lot of his earnings or savings to go to India, go to China, and get involved in conferences and trainings, so many things. So if we try to give those things here in Nepal, at least the students who are not yet earning, they can at least contribute and get an experience, and maybe that will also create an opportunity for them. And here, if you see the scenario of like 5 years, if you go 5 years back, maybe 95% of the students, they're not interested. Okay, we don't have any scope for small animals, so I'm not going to make a living out of it. So rather, I would go for poultry practice, I'll go for large animal, or I'll go and get some government jobs, or I'll go to other countries. I mean, there are lots of vet students, Nepali vet students who are there in US, who are there in Germany, who are there, even Pranav's friend, and even my friends, many of them, they've migrated there because they didn't feel that, okay, I've already completed the studies here, so I'm not going to get a good earning. So rather than spending my life here, I'd go there and make my life happier. So even those things, now if we try to orient both at the both end, because here, one, we're trying to upgrade the standards of the veterinary community, and on the other end, we're also trying to promote a kind of responsible pet ownership. So what a pet is like, so how do you feed them, what is a proper veterinary care. So people here, they're not still aware. I mean, I would say more than 60% of the people here in Nepal, they're not even 60, I would 70 or 80% would be, they don't know preventive medicines, they don't know about vaccines. And even if we say we have radiology services for dogs, and they would say, okay, does X-ray work for dogs? So they're kind of in a very primitive situation. So once we have all those things here, and then they start realizing, okay, this is what a dog's healthcare is like. So we need to be careful about our dog's health, because here people also look dog as the part of the family. So they also want to give a quality of life and the medical services, at least which is affordable. So since they didn't had it previously, they have no other option. So dog gets sick, and they don't want to kill it, so they send it out. So that's also one major issue of increasing dog population. So everyone here is more concerned about, okay, Nepal is having lots of dog and street dogs, accident with the street dogs, and then zoonotic diseases related to strays and all those things. But they've never realized the real cause of all those issues. So as per our 10, 15 years of experience, we've tried to identify all those things. And one major cause of this thing is proper healthcare facility, because they don't know what to do with the sick dog. And in our culture, we don't prefer killing a dog, euthanizing or killing a dog. So what they do is, like, the simplest thing is they kind of let the dog go out and survive on its own. If you're lucky, you'll survive. Otherwise, you die of the disease. And similar thing happens here when the own pet, they have babies, because the culture of spay neuter is not yet very familiar here, and people are not aware. So they think that it's a God grace to have puppies. So once they have puppies, it's kind of fun for at least a week, but then it becomes trouble, and there are no other people who can adopt the dog, so they let them out in the street. So there are kind of mixed things going on around here. So even our involvement in the contribution for the community is, like, both in the veterinary sector as well as the real community here.
That's awesome. That's awesome. Man, I feel like you got to the fourth question. Describe to us the things that are the most challenging for you in working in the clinic and with the community you serve. You touched on a lot of those in our discussion thus far, but if you can describe some of the things that are most challenging for you in working in the clinic and with the community you serve.
So the most challenging thing is using the well-equipped machineries. So nowadays, last week I had a dog, like, he was brought into the clinic with a complaint of coughing. He had a cough. So I thought it could be kennel cough, and then I just examined it, and then I kept it on antibiotic. The next day, the owner said the dog he started having vomiting. I was surprised, because it normally doesn't happen. Then I went for the X-ray. In the X-ray, the heart was super enlarged. It was super big. So I was not sure what to do. And then I talked to my friend in America, and she said, like, the heart must be filled with blood. It's called hemopericardium. And then I watched the YouTube, and I did that. I pricked the heart. I took the blood out. I was not sure how did it accumulate there. And when I asked her, she said it could be a tumor. So we didn't have a proper diagnostic approach to that issue. So if I get to, like, the most important thing is, honestly, I've never seen a proper hospital and proper animal practice. I have been doing everything from the knowledge that I get from my book or from the reference that I get from my friends. So if I could see that live, I would have developed a lot more confidence on myself. So for any search, today I posted a video about, like, the dog who was fed with chicken head and foot. All the bones got stuck in this intestine. I removed it surgically. So are you following us in Facebook?
Yeah.
So I posted there. It was like, you cannot imagine. It was this amount of bone inside the intestine. So I've never seen it done before. And when I opened up the dog, there was something wrong with the intestine. I was not sure what it was, because the intestine didn't look normal. So I was not sure. So if I get to see some sort of things like that, I would be more confident to talk to the dog owner. So this is the situation, what I saw inside. So we should do this. So I believe, like, my exposure is not, is not that very much. So if I can get to see or talk to well-experienced people, it would enhance my practice more, and I'll be more confident.
Yeah. That's awesome. What about challenges in the community?
So it's the same, like, community people, they are more reluctant to come over to the vet services that we provide, because they need to walk their dog, or, or the monetary issues, because if they have to go for blood test or radiology or anything, so they need to pay money for that. And then if they cannot afford it, they will not treat the dogs. That's the main issue. So there are many cases. So my another dream is to start community hospital for small animals. You know, so people can come and they can get the animal treated for free. Because we have leptospira in dogs here, which is communicable to humans too. We talk only about rabies. Most of the people, they know that dog gives us rabies. That's it. So there are more dangerous diseases than rabies, which can kill them. They have no idea, right? So these are the things. If we can have something like which the community people can afford it, or they can get free treatment from here, so that we can give more services to more animals, and we can aware a lot of more people regarding.
Yeah, actually, that's one project that we are actually working on. I just gave you a hint about what we had been working on. That's a community-based project, and like you said, one of the issues here in Nepal is like awareness of the pets that you have, and not only of how you rear the pet or having a pet, also the benefits and the risk of diseases. I mean, the zoonotic diseases. So that's one issue. So unless they are aware of the things that what's going on with the dog, the issues, the diseases, and the most importantly, the communicable diseases that the pets could have. It's not only about rabies or but leptospira. There are so many kinds of since I'm not a technical person, but the people then they're not technical person as well. The pet owners only like 1 or 0.1% could be the technical person. So we should also be able to communicate things properly, how to have a dog, the issues, the preventive medicines, the worms, and because the place where we live, Nepal or Bhaktapur, here even the street dogs have a close bonding with the community people. We don't call it strays. We have stray dogs which have the defined community and move from one place to another place. We also have community dogs. Here we have a small 4 or 5 buildings, and it's like a typical historic Nepali home setting where 4 of the houses they are close by. They are part of the family. They're not. They could be, how do you say, first cousins or so. So they have 4 or 5 houses, and they have a square. So where they share the common playground or something. So they have few dogs there whom they feed. So the dog does not belong to any of the houses, but all the houses, the members or the family members, they feed them, they take care of them, and they also try to provide them medical services, right? So they're in very close contact with the kids and the elderly people, right? And we have pet dogs. So the community here is so much compact and so much in touch or in contact with the dogs. So people are not aware of the issues with a diseased dog. So that's also one issue that we're having, the problem. And when once we're able to take care of that issues, and then comes the economical issue or the financial burden that has to be borne. So fundamentally, I would say that's one thing what everyone should plan. And even we tried few of that with piloting that. Educating the school children about rabies, about having a dog, about how to the basic fundamentals. Because we thought school children were the one who would be a medium for us to transfer our knowledge. Because if we go community-based campaigning and all those things, that might not work. And in some cases, the cases here are so variable, and then we kind of closely work with the community and talk to the elderly people, and we distribute brochures and all those things, and we try to say that okay, these are the issues, these are the things, we will help you with this, and that's also one effective way, but it might not work 100%. So we also tried some community schools where we went there and we tried to talk with the kids. We did that with kids of grade 6, 7, 8, 9, and 10. So out of them, I think grade 8 were the most effective ones, because grade 6 or 7, they were too young, and the parents never took seriously the things that they told. And grade 10, they were almost going to the high school, so they were very childish, and they was like, okay, come on, you don't need to teach me, I'm not going to do that. So and 8 and 9 grade students, they took that very seriously, and they were also able to convince their parents, and we had a quite good impact. after the studies, and we also did a follow-up test, like, okay, after 3 months, what's the scenario? And they were quite interested. They also spread the knowledge that they had. Even if they had less knowledge, they also started doing things properly in the community, in the neighborhood. And when they knew about vaccinating or using preventive medicines for the dog, they went back home. They told their parents, and they had the vet visit and all those things. So it's kind of a holistic approach that you should take, the community thing. And also, I think if we are able to take care of those things from the basics, even if you have a very fancy hospital, people are not going to come there because they don't know what a veterinary service is. So it should be like not only a bottom-up approach, it's like a holistic approach where you have different points and where you try to feed all the points, and then you get a proper output.
That's awesome. That's awesome. That's why we admire you here, man. We love what you all are doing. Oh, by the way, we secured some funding for that community project. And so I'll be reaching out to you all once, all this COVID-19 stuff gets settled. We'll get that money, and we'll start working on that project. All right. All right. So you've had many international students and veterinarians in your veterinarian interns in your clinic over time. How might Nepal's approach to veterinary medicine differ from those in the U.S. or other countries of those students and veterinarians that you interacted with?
So, like, we have a very different approach than the people who come here, because I've seen a lot of students, like from the very beginning of their semester to the final year students. I've seen them here. So the students from America and Europe, they are completely dependent on machines. So if they don't have anything, they're helpless. And here we have nothing, we work from a different, from a different angle. We try to, because what I believe is every disease has its peculiar presentation. And then we try to recognize that rather than trusting on the machine, because we don't have, machine would make our life easier, but we don't have it. We cannot afford it. So we use a different approach. So that's the first difference that I have noticed. And the other thing is, like, we use a lot of traditional medicines here, not relying on the fancy things what the other students uses. So that's the major thing that I've seen here.
Yeah.
So if we get a dog with a fracture, like what the normal student they recommend is go for a plating. So I'll send you the picture. I had a dog which was crushed by a vehicle, and then all the bones were exposed. I went there, I used purple cabbage and honey. Without surgery, without anything, it healed in 10 days.
Wow. Wow.
Yeah. So that's how we use. So if I would have shown that to the student from America and Europe, they would have suggested we need to go for the surgery, we need to go for, remodeling of the bone, we need to go for implants, this and that. And we used only the local resources that we have. Purple cabbage is in our field. Honey is in our kitchen. So it's done.
That's awesome. That's awesome. That's awesome.
So that's the amazing thing. And they are really happy to see that here, because they'll be amazed. So how do you, it seems them like they feel like magic. I'll forward that to Sandeep, and Sandeep will send you the picture. You'll be surprised to see that in 10 days time, to open up leg with the fractured fingers, everything was set.
Wow.
And then how much would a cabbage cost? Less than $2, right? So the whole cabbage would heal the whole leg. How much would the honey cost? $1. So in $3, the leg is fixed.
Wow.
So if that would have been in America, the owner had to pay like $1,000.
Yes. I just had a friend whose puppy had a fractured leg. $4,000.
Yeah. So we use slug. We feed slug to the dog, and slug heals the bone perfectly.
Wow. That's awesome.
Right?
That's awesome.
So those are the things that I do it here. which costs no money, but we treat animals.
Yeah.
So that's the difference between, like, even though I've not seen anything, but it's the regular work for us, but it is magic for the people who've not seen it.
Yeah, that we had so many cases because here in Nepal we consider ourselves to be one of the most sophisticated veterinary service providers here. But if you compare that with the services that the Westerners have, like your university hospital, I would not say your university hospital because that has to be a standard, but at least a normal vet clinic in Nepal, ours facility is not even like 5% of what you guys have in the West or in the US.
Not even 5%.
Not even, that's what I'm saying. Not even 5%. So when they come here, the first thing I always say is like, you guys have come from a different world, I would say. Not only country, but a different world. Because for us, US is maybe, I think Mars would be near than the US. If you talk about the differences, the cultural differences, the environment, the people, and the facilities, and all those things. So, and don't expect too high. And the culture here is completely different, and also the practice. So since we have very less facilities or the diagnostic equipments, so we try to use our traditional approaches. And we had a very funny incident, so where a dog had an issue with his intestine. So they were volunteers, and Pranav had like a different approach where he had ultrasound probes in his hands. So he just felt it, and then he said that, okay, I think there's some issues with the intestine. So since we didn't have an ultrasound, so we said, why don't we refer that to ultrasoundologist or an X-ray? So he went for an X-ray, and the X-ray results were like they had some obstruction in the intestine. So the students were surprised. So without anything, how did you recognize that? So it's all about the things that you do, because it's like if you're helpless, you have to do something for your survival, and then your instincts come in. So maybe your vision or the sense of smell or your feeling or from the fingers or anything. So for them, it was a complete amazement. So they were literally shocked to get that experience with the eyes. So how on earth could Dr. Pranav do that? And literally, it was a kind of amazing thing. It was just like magic for kids. So these are also one of the differences, and also the students who come from there, they get to see everything so closely, and they get to see so many diseases and so many issues that they only get that in the books or in the videos, because there's so many issues they never get that in the US or developed countries. So here it's very common. If you talk about a severe skin infection or a severe blood infection, ecanis, I mean protozoals, and so many things. And that's because people are more into preventive medicines there, and they don't have that. So since they don't have the basic preventive medicines and they don't get a proper healthcare facility, the patient or the dogs, they come here at a very severe stages. So that's very, very, very interesting for the students. So that's what I always tell them. This is a kind of a lifetime opportunity for you, because you're in a third world country, I would say. I mean, Nepal, India, Pakistan, Bangladesh, and those places are where there's no upgraded healthcare facility, and here you get to see hundreds of those cases. So that's one interesting opportunity for the best students. So that's also, I would say that that's very amazing for the students, and they really love that. Yeah.
Yeah. Man, you guys touched on like so much already in terms of veterinarians and professionals that need to be prepared to deal with things that they might not encounter every time. And then even talking about resources and how it's important to really think about, if I'm in this community, I don't have the resource, how would I treat this animal? I think that's crucial. And so for another question, all right, so your clinic does a great job in engaging with the community, as well as engaging with the international community. Can you describe to us why global engagement is important for veterinary professionals?
So like you see, like the burning issue, Corona, So this is what we want to like bring the awareness in the society. So there are a lot of other diseases which could be in pandemic.
Yeah.
You know. So if you just like you have Lyme in your country, Lyme diseases. Similar diseases are here. We have trypanosoma, like we have leptospira,
Yeah.
which could bring a lot of changes here. Human animal, communicable diseases, like it's called zoonotic diseases. So unless and until, because I too don't know if how do I diagnose if a dog has a tuberculosis?
Yeah.
You know, it's a very common disease because it's seen in cattle, it's seen in elephants, it's seen in human beings. So if the owner has a TB, his dog might have TB. So how would I diagnose it? You know, so time might come. We can have tuberculosis havoc all over Nepal.
Yeah.
Because we are living with diseases all over us. It's not only rabies. So unless and like I said, I've never seen a hospital myself. I've never seen a surgery room. You know, I'm doing surgery in my place. Like it's been like 17 years, but I've never seen a surgery room. How is it gonna be? I still dream of a surgery room with the light and then with everything sophisticated things getting sterilized. You know, what if any nosocomial infection occurs in the animal that I operate on? I still believe that my surgery is successful only because of the grace of a God. So that's why global interaction is needed. Unless if I would not have met so many American people or European people, I would not have become a vet. Because they didn't take me to the surgery room, but they said to me, your surgery room has to be like this. You need to maintain this and these things. I visualized it and I did it. So if it becomes more frequent, if I get more opportunity to be with them, to see things, see how. So till now, I'm not. It's just my imagination. Imagine when I see it, what impact will I make in my society?
Yeah.
You know? That's my dream. Before seeing the real thing, I've done so much of things in my society. If I get an opportunity to be in the real veterinary school, how they are taught. Because my school was just a building with chairs and table, no books, nothing. Old guy comes, he reads the book, goes, right? That's how I become a vet. I never did a single surgery when I was in my vet school. I never put a single catheter in a dog when I was in my vet school.
Wow.
And then when the vet student come here, they show me the picture, like how are they taught? They have a dummy animal. They see all the lymph nodes. They see blood vessels. They know how to prick. And they know each muscles of the body. I saw that muscle only when I got the dead dog. So that was my thing, how I became a vet. And when I compared, oh my God, if I had that sort of book when I was a student, I would have developed more. If I had that sort of lab, I would have developed more. And I'm trying to improvise my practice that way so that a lot of students can get motivated and that they can become good vet, not only vet, right?
Yeah. Yeah.
So if we have proper global interaction and proper communication, we can develop the sector not only for us, for the whole society.
Wow. Wow.
That's what I've always been telling the students here. It's more like we will have the students, we'll have our expertise here, but it's very limited. I would say Pranav would let them know the things that Pranav knows, but there are also so many things that the students might know more than Pranav because they're exposed to a very sophisticated facility. So they don't have the experience of a real veterinary practice, but they do have the theoretical knowledge or they have the exposure. At least they know how a vet hospital looks like. So the certain protocols or the systems that they've been working on. So the global engagement in my way is like engagement between two different parts of the world where there's sharing between the two. There's not only one person who delivers. There are two person who are delivering their experiences and sharing because for us it's a very interesting opportunity. like last time you sent us books, right? Those books were like, I mean, for maybe for Pranav it's not a big deal, but for the intern students here and the new vets, they were quite amazed to see that, because even the university library does not have the books that we have. I mean, we are proud to say that because we've been collecting that for Pranav and for all of us. And one point of time, what we think is like, why don't we have this Vet for a Pet or this institution as a knowledge sharing center where the students can come in, they can share the experiences, they can do hands-on practices, they can get. I mean, we do have so much of online learning research materials that we have saved, so they can come and sit by, they can get updated on those things. We have books which I mean some of the books, even the vet university, they don't have that.
So that's why we developed our Facebook page, because I developed my Facebook page because when I was a student, I had no place to learn things. So I post everything in my Facebook, about the diseases, about the surgery I do, and then what are the causes that we had to do the surgery. So we can aware people. So if you do these things, you can prevent your dog getting these issues. About tumors, about the obstructions. So that's why I started the Facebook. And on Facebook, a lot of vet students, they follow my Facebook page because it's very informative for them.
Yeah.
So that's how we are trying to upgrade in a holistic way.
Yeah. And every time, I mean, we talk about these issues, the only priority would be, I mean, we should have some research here on zoonotic diseases. So like even last time in my mail, I think it was a very not so kind email to you, but still that was actually, because here there are few organizations or few people doing One Health program. That's they've certain things that they're doing, but I don't see any effective outcomes from the project, because One Health, it's a huge sector, and there's approach or sectoral approach where climate change issues, health issues, educational issues, technological issues, everything is one, because that's one of the global burning scenario, One Health issue. Yeah. So that's also what we should focus on. And Nepal is very, 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 very less supportive on doing research and documentation, because the priority of the people and also the government is more on developing things. Because here what we lack is like basic facilities of water, basic facility of electricity, basic healthcare for children, basic maternity healthcare, and basic human healthcare for elderly people. We don't have roads, infrastructures. So these kinds of things like cross-cultural or cross-cutting issues where human and animal health comes, that's more of a least priority, and even the government is not that prioritized. So we should also be able to prioritize those issues. So once the document or the research findings is there, we can advocate based on those things.
Wow. Yeah.
So once we have that, because I also talk to many of the students, not only from the Purdue University, from the University, Georgia University in Canada, or a few other universities there. They've been doing that, and I always offer them, once you are able to, because they have very good knowledge on documentation, writing skills, analytical skills, and all those things, but they don't have the real scenario. What we have here, we have the scenario, the case is there, the disease is there, the client is there, but we don't have the things what can be very fancy. She's my daughter now. Okay. So this is the facility of working from home.
No, that's awesome.
So once, for me, like global engagement is more of engaging two parties, where you have the case and where you have the expertise. Once the expertise mix, and then we get a global benefit.
That's awesome. That's awesome.
On knowledge transfer. So here for us, I've been always telling them, why don't we kind of try to upgrade our students? So for us, here the vets, they can never afford to get a training on the western part of the country, I mean the world, because it's very, very, very expensive, and they would have to spend, I would say, their earnings for like 3 or 4 years of their earnings to just get one training.
Wow.
And that's super expensive. So if you go to India, which is the cheapest one, they're good, but they're not up to mark, because that's completely different from the Western part. And China is quite affordable, but the problem is like 4 words. And we can't get trained on Chinese language just to get a training for like 3 weeks. So that's the difference. And other part of the, even they say that, I mean, he's been telling that Singapore is very nice for surgeries and all those things, but Singapore is super expensive, super expensive, and even Taiwan. So, and they don't have fundings or scholarships or any other medium to support the cost. I mean, here we could, I mean, the vets here and even we could just contribute the travel cost, but the admission fees and all those things, that's super expensive. I've been trying to look for so many training programs and all those things, and the average cost is like $3,000, $4,000, 7,000, 8,000, and that's beyond our imagination, right? So maybe that could also be one part of the thing where, I mean, we could get trained, or our team could get trained, and we could spread that so that at least the basics could be done here. And when they get to a mark, and then they could go further and upgrade that. For instance, 13 years back, Pranav went to India to get trained on spay neuter. That's the least, I would say, that's the least vet should get, which normally is done in a vet school. But now here, the Nepalese, they come here. We at least save like $500 or $600 of their expenses because they can get trained here. And if they need specialized surgeries, let's say for orthopedic surgeries, so we train them the basic, and then if you want that, you can go and get that wherever you want. But what we have done is like we have started providing facilities for the basics of surgeries, and at least spay neuter surgeries are easily done here. So that way, we're also not only training ourselves, we're training the community, and we're spreading our knowledge, because in our part of the world, what we think is like knowledge is not the thing that you should keep with you. It's not like money. If you save your money and then it grows, but knowledge, if you save that, you're going to become a dumb. So once you spread that, you'll also refresh yourself, and you'll also start training yourself to get new knowledge and start disseminating it. So it goes on and on and on, and then it creates like a whirlpool. So you have a drop, and then it spreads out and out. So it's more like a philosophical thing.
Yeah, no, that's amazing. That's awesome. That's awesome. All right. Well, those were all the questions that I had. I really, really appreciate you all taking time out your day, especially on lockdown there in Nepal, like we're on lockdown here in the U.S., to speak with us, speak with our students on the importance of engaging in the community, being mindful of the cultural differences, and then just the whole concept of global engagement and the importance of exchanging information and sharing information. Any last things you guys want to say?
So can you help us like spreading our Facebook page, and then and then if any senior vets can comment on whatever we've been working on, that would help us improvise our work.
Awesome. Yeah, we'll do that. We'll do that right now.
Any experts who have been working on that field, and if he sees our work, and if he could comment on what we've been working, we can develop or we can improvise on what we've been doing.
That's awesome. Yeah, we'll get that out, and we'll get that out to our clinics and some of the other veterinarians around the community as well, to engage with the Facebook. I think that'd be awesome.
If we have any issues, if we have somebody just to call and ask, or just to send radiographs or photographs about the issues, if they can give us any suggestions, that would help us, a lot.
All right, we'll do. And some of the students that are listening in on this, they're involved in One Health research as well. They're getting their master's degrees in public health and One Health, and so they have a specific project that they have to do before they graduate, in which they have to publish an article. And so those are interesting
as well, because like we have, like I said, we can do some research on tuberculosis on dogs, because we have a tuberculosis hospital very nearby. And then like, impact of tuberculosis on small animals. That would be a very interesting topic because I've never heard anybody do anything on that.
All right, you heard it, students. You heard it. We got some projects. Well, thank you all so much for everything. We truly appreciate it. Namaste.
Thank you. Thank you so much. Bye, Gadu. Bye. Here's my daughter. She wants to see. Bye.
It's so cute.
Bye. Have a good day. So stay relaxed. No more corona.
No more corona.
You have Home Garden rather than Corona. Use Home Garden rather than Corona.
Bye. Take care. See you soon.
Take care.